And we are live now, Dr. Swathi. So excited to have you on. Welcome, everyone, to another live edition of Real Talk, produced by your award-winning Let's Talk America with host Shayna Thornton Radio Podcast. Of course, I am Shayna, your on-air host and executive producer, and we've been going 11 years strong on this podcasting and this journalistic platform. And tonight, we've got a great topic you don't want to miss. We're going to be talking about the latest in weight loss drugs, okay? We're going to talk about the GLP-1 class. Many of you know it. We're going to get into some of the brand names, right? If you're saying, well, this doesn't apply to me. We've all heard so much about these drugs and how safe are they? And what are the long-term effects? I'm no expert, but I am super excited tonight on this live Sunday night to introduce you. It's her world debut on this show, but of course, she's not new to speaking with consumers and patients. It's the one and only acclaimed Pharm.D, Dr. Swathi Varanasi. I hope I got that right, Diaz. And she said, just lovingly call her Dr. Swathi. Dr. Swathi, welcome to Let's Talk America.
Thank you so much for having me.
Oh, excited to have you on, okay? But before we dive into the questions about the GLP-1 weight loss drugs, okay? Many people may know about Ozempic or other names. First, we've got to ask the human side of all of this. You're an acclaimed Pharm.D. You're well-known. You've traveled to work with many people explaining very important things about drugs and other things that are out there, such as risk factors and disease states. But what drives you? Right? What drives you to really be so adamant about making sure that consumers and patients are up to date on the latest drug options that are out there as a pharmacist? Help us out in the next 2 minutes.
Yes, so I'm an integrative pharmacist. So I'm conventionally trained as a pharmacist, then after that pursued my postdoctoral residency in integrative medicine. So I'm always thinking about how can I improve the quality of life of patients. And so this might be through prescription medications, but it also might be through supplements or nutrition or, thinking about lifestyle modifications and sleep and all of those things. So what really drives me is how can I help patients feel better? And so, that really pertains to today's topic, but at the end of the day, it's like, how can I really help someone feel like their life has improved?
Yeah, I love that because it is about improving our lives, right? And one of the things I always tell family and friends, and this is Shayna, this is my personal perspective on it. I think when we talk about living longer right now, when we talk about having better quality of life, I think it's very dismissive of us if we did not acknowledge a lot of that has to do with the evolution of drugs, pharmaceuticals, right? We have to know that. I mean, I know a lot of people frown upon drugs. I don't want to be on one more prescription, Dr. Swathi. But the reality, we know this in certain classes, such as, probably all, but certainly when you talk about epilepsy, when you talk about hypertension, when you talk about diabetes, right? These are things that are now being able to be controlled because of compliant patients that simply did not exist 80 years ago, right? There were very few options for a diabetic. It was straight insulin on the needles, and those were huge needles, right? And so much has changed now where it's one shot some people can do once a week or perhaps even once a month. So I do want to recognize that, but we've got to get into the safety of it. We're going to talk real talk. This is Real Talk for real people. If you're watching us live, welcome. If you're watching us on replay, welcome to you also. But if you're watching us live, which is Sunday, it is October 27th. We're shortly after 8:30 p.m. Eastern Standard Time, and we have an important topic for you. We're talking about weight loss drugs, okay? And many of you know them. Many of you have been on it yourselves. You've dived in it. You've teased with it here and there. But tonight we have an expert on with us. And if you've ever said, if I can stop a Pharm.D, right? She has doctors in pharmacy. If I could ask her a question about weight loss drugs. And by the way, if you're on with us and you've got a question about a side effect for high blood pressure medicine, diabetes, throw that in too. We're talking about weight loss, but Dr. Swathi doesn't mind, I'm sure, addressing that. If you have a question about perhaps an antibiotic and how it's reacting to your body, throw that in. Now, I do want to say this because we're a responsible platform. This is for educational, general purposes only. For specific information on your body and your type and your blood type and your history with 1 to 5 kids, you're going to ask your own provider and your own specific pharmacist in your local area who's filling your prescriptions. But for general educational purposes, we got Dr. Swathi with us tonight, and she's tackling your questions. Get your questions in, okay? I'm going to echo that again. People always say, if I was standing in front of a pharmacist, a drug expert, I would ask them this, and that. Here's your opportunity to do it as well. And you heard her say she's obviously one that loves to look at the whole scope of things and the person. So also get your questions in. If you think you're being restless at night, maybe it's a medication you're on, let's get that education out front and center. But first, Dr. Swathi, so excited to have you on. I've got to ask about the GLP-1 drug category. Many of you, again, maybe like never heard of it. We're talking about Ozempic, of drugs of that sort. And she's going to probably share more brand names that you're familiar with. But first and foremost, I've got to ask this, the class of drugs, in layman's term, and you're obviously you're very well versed in medical terms, but for the most of us, we're not nurses, we're not physicians or physician assistants or pharmacists. Tell us about this new class of drug. And I say new class of drugs, I don't know. Is it necessarily new, Dr. Swathi? And what is the purpose of it? And who qualifies? Because I'll ask this loaded question. There seems to be a spectrum of people that qualify. I know people that are obese that have, and then people not so obese, but they're saying they're pre-diabetic. Help us out, because this is a huge topic and we want to get to it tonight.
Yes, definitely. So GLP-1, so such a big question. So GLP-1s, it stands for glucagon-like peptide 1. So really what that means is that all these drugs that we're talking about in this category are actually GLP-1 blockers. So the way that they work is that they block this specific cascade in the body. And so when you block this GLP-1 in the body with these drugs, it increases insulin secretion and decreases glucagon secretion. So really what those fancy words mean is that it decreases your blood sugar levels. So initially when GLP-1s were being researched and everything, they were initially and FDA approved to look at how they can help type 2 diabetic patients. Later down the line, of course, as they did these studies, they found that GLP-1s actually also help to suppress, or GLP-1 blockers, I should say, or GLP-1 inhibitors, so this class of drugs, actually helps to suppress appetite. And so with the suppression of appetite, people are realizing, oh, wow, that means that the patients who are taking these drugs are often losing weight. So, first and foremost, they were FDA approved. So when I say they, I mean Ozempic is the most common one that everyone seems to be talking about.
Yes.
That one is actually FDA approved for type 2 diabetic patients. It's not FDA approved for weight loss. But that same active ingredient that, Ozempic is the brand name, semaglutide is the generic name. And so that generic name, they actually rebranded to be called Wegovy. And so Wegovy is FDA approved specifically for weight management. However, if we're thinking about these two medications, and of course, there are other GLP-1 blockers like Mounjaro and Victoza and other things that are different active ingredients. But, I just want to talk about the most common ones that you probably heard of, which are Ozempic and Wegovy. Again, the same active ingredient, but Ozempic is FDA approved for type 2 diabetes, and Wegovy is FDA approved for weight management. That being said, though, Wegovy is actually only FDA approved for two specific subsets of the population. So it's not FDA approved for everyone. It's FDA approved for patients who have a BMI of over 30. So this is what the medical, team would denote as obese.
Okay.
Or if you have a BMI of 27 and above, which is denoted as overweight, but you have at least one weight-related, what's called a comorbidity. So that's if you have another chronic disease or condition that, is likely attributed to part of your, being overweight. So that could be type 2 diabetes, that could be hypertension or high blood pressure or dyslipidemia. So that is if you have, high cholesterol. So all of those things kind of play a role. But what we really need to get to here is that, Ozempic is the one that's being used off-label. Off-label just means it's not FDA approved for that, but with the doctor's discretion or with the healthcare provider's discretion, they are actually writing the prescription, even though the patient doesn't fit within these parameters, and it's not FDA approved for that particular, use case.
Yeah. And thank you for sharing. I've heard so much about it because I know of individuals who have heard rumors, urban myths, if you will, and I don't know how true it is. They'll say, but their physician or their provider denied them, but it went to a weight loss clinic and they got approved. And is that happening? Is that an urban myth? Or you're saying there are certainly documented cases or well-known cases, perhaps, or just knowing the real world where that certainly is. Are they circumventing the system that's in place for safety?
So that's the thing, right? So when I say people, rather, physicians and healthcare providers in general are always weighing the risk versus benefit ratio. And as a pharmacist, that's exactly what I do too. And so right now, a lot of the healthcare providers are unaware of some of the risks. So they only see the benefits. And so there are some healthcare providers that then say, okay, I am not comfortable writing this prescription for you. It's a little high risk for you simply because you're not in the FDA approved population that I just mentioned. However, there are other healthcare providers who are just looking at this risk versus benefit ratio, and they decide, with their clinical discretion that they're going to write the prescription for a patient who doesn't fit in that subpopulation because they don't understand the risk and they just understand the benefit. At least that's my perception.
Yeah, yeah. And I think that's such a great point. And hopefully you can, thank you, Jarnine out of Atlanta. She's watching us live. Hopefully you can see me now. Thank you. We want your questions, your feedback. We're talking about popular weight loss drugs that are out there. And Jarnine, I know, is with us. She's an acclaimed fitness guru. So we'd love to have your take on that as well, because I know you believe, Jarnine, in doing it the traditional way of working out and getting fit and being strong physically. So we'd love to hear your feedback on this as well. Dr. Swathi, you certainly said something that I think hits home for so many people. People are looking at the benefit, right, and not so much the risk of it. Thank you so much. We have a provider on with us out of Atlanta as well. This is Brandy Green. Thank you so much for being on with us. She said, excellent topic, giving her greetings to you, Dr. Swathi. So I think they're looking at the benefits and not so much the risk of it as well, which the benefit is what? I mean, we've seen very well-known celebrities like Oprah Winfrey and others drop weight, and they're like, hey, and here I am, I'm thinking of myself, I'm over 40. It's sort of appealing, Dr. Swathi, to say, I've had children, right? I've had a metabolism that has slowed down. You're telling me I can lose the weight magical and turn into the size I was at 25 years old before kids? I think that is a very appealing benefit for a lot of people out there, right? Or people that may have perhaps battled with weight gain or obesity all of their life. Here is that chance. And I'm going to get you to touch on that, but I do have a question. And this is your show. We want the questions on. We want you to give the feedback. If you're with Dr. Swathi or you challenge some of that, this is your platform. First question is a nurse out of Atlanta, Georgia. Thank you, Cheryl, for being on with us. She says, is America leading the world in encouraging weight loss drugs? If so, why do you suppose that is? Great question for you, Dr. Swathi, as we also try to sort of tackle the benefits and the risk of it.
Yes, I think that, America, whether or not we know it, being Americans, sets the standard for a lot of culture, and especially the Western culture. And, what's cool, what's not, if you think about, the root of Hollywood and everything, right, comes out of America. And so if this is like what's deemed as cool, or what certain people who are deemed as, having a great, reputation for, their looks or, their talent and this, that, and the other, I think that America is leading it. Whether or not that's a good thing is another thing. However, I do think, yes, like, to answer your question, I do think America is leading it.
Yeah. And I think you're saying some of that could just be the part of Hollywood, or just,
yeah.
And culturally, on a sociologist would have to tackle this, why we may be obsessed with physical thing. And I think that's probably worldwide, but obviously maybe being thinner or being thin is something we hold on to. I do want to say this on that point, but I don't want us to be remiss in the fact, and not that everybody needs to be the same size. And certainly I'm a very huge advocate for people being comfortable in their own skin and who they are. But we'd be remiss, Dr. Swathi, and to the nurse Cheryl that's on with us, to dismiss that we do know that excessive weight has its dangers, yes, right? And we do need to be honest and talk about that, because that's beyond and separate from vanity, right? Because we can say, well, I'm trying to be as thin as I was at 25 years old. But the reality is every medical expert, including you, Dr. Swathi, will come on here and say, with the excess weight comes the prediabetes and the diabetes, which are disease states not to take lightly. With it comes other things, higher risk of cancers. So there are reasons for, perhaps, let's be real, other than the vanity part, why people do do want to lose the weight. So Dr. Swathi, great question for you as a Pharm.D that's seen so much out there with consumers. Does that, with that being in our ear, that we have medical providers and experts like you by saying, you've got to watch the weight, you've got to watch the blood sugar increase, does that also come with people being obsessed with getting thinner in America?
Yes, I think that is certainly a part of it. And, as we're seeing as the years are passing, that the obesity rates continue to rise, and the, quick, easy fixes, as I saw, in the comments, is like that's what people are looking for. So whether it's a quick, easy, let me grab this meal because it takes 1 minute of preparation and then I have it in my hand immediately, all the way to I want a quick fix to solve this problem that has been likely, I don't even want to use the word problem, but this like something that has been going on for years and years. And so thinking that we can look at quick fixes as something that's going to that's going to change our health is really not something that we should be doing.
I want to tackle that, and thank you, Journey, of course, who is huge exercise guru and advocate out of Atlanta, Georgia. Again, she says she agrees this topic needs to be talked about. She says it's such a health risk, and she says perhaps many people are looking for that quick fix, just like you said. Let's talk about that quick fix that you and Journey are highlighting. But what happens, and I want to take a typical person here in America, woman or man, but let's take a woman, right? She perhaps has had 1 to 3 kids and her metabolism greatly slowing down the older she gets. She's approaching 50 years old, no matter what she's done, and which means also to the experts out there, that means she's probably already, if not, has started going through menopause or perimenopause, Dr. Swathi, right?
Yeah.
Which has its own challenges of weight loss or weight gain that will not bulge, even though she's working out in the gym 24/7.
Yeah.
So what happens when she's saying, I've tried it all. I've tried the keto. No knock against keto out there, low carb lifestyle lovers. I've got many friends that love it, but they've tried it. They've tried the Dr. Atkins diet. They've been all over the place. They've stayed at the gym back to back to back, only to see a 2-pound drop or only to see a reduction in the waist by very minimum. What do they say? Because we are saying a quick fix, but what if they're just exhausted mentally of trying, and yet they're saying not losing weight, the A1C is still over 13. I mean, what would you say to those people really looking for a solution for all the right reasons?
So I think that's, one of the things with using GLP-1 weight loss drugs or GLP-1 blockers is that, oftentimes, at least now, people are just being prescribed these GLP-1s and then they're just off to the races and there's nothing else done in addition. Yeah. And so I think that for patients like the one you're describing, woman over 50, and she's really looking for, something else that she can add because she's already working out, she's already trying to eat healthy. I think that if she fits within the parameters of the population that would suit a GLP-1, I think that she could be a great fit, but it would have to be the GLP-1 blocker paired with some other changes. So that would be nutritional changes. What movement is she doing? Is it just cardio? Or is she actually thinking about strength training, resistance training? Yeah. Is she what sort of movement is it? Is it low intensity, high intensity? So some of these things are really important. And then as per metabolism, a lot of that is tied to sleep. And so how is she sleeping? Yes. So I have to take the integrative medicine lens here and say, the GLP-1 could be a great fit for her, but not on its own.
Yeah. And that's such a great point, because there are different things that be added out there. And I do want to give a shout out. We have certainly had pulmonologists who work with a lot of individuals suffering from sleep apnea. And many have said the third pillar of health. We talk about diet, we talk about exercise, but they talk about that sleep. And they have documented some very well-known cases of when you start getting suffice sleep, the body will actually help with your weight loss journey with that. So it's something to remember. We've got a great question out of Glenn out of Atlanta Metro. Thanks for watching us, sir. I've heard rumors, he says, that because so many people are taking the drug meant for diabetes for the purpose of weight loss, that it's causing shortages for those who actually need the drug to treat type 2 diabetes. Great question, Glenn, and great comment. I've also heard that. I've heard pharmacists such as yourself, those who are working retail pharmacy up the street where we go get our vitamins and everything else, they'll say that it's a back order of it. I know that was documented previously. Is that still the case for this drug?
So Glenn, you are correct. The rumor is true. That is something that has been going on and is becoming more and more of an issue. And, GLP-1 blockers, so this entire class of medications, the way that it works is that, if someone is diagnosed with type 2 diabetes, first they're put on metformin to try to manage their blood sugar. Then after that, oftentimes the healthcare provider will think about what other prescription medications can I put this patient on in addition to metformin? And this is when GLP-1 blockers become a part of the conversation. So this is not for newly diagnosed type 2 diabetic patients. This is for later down the line. And so, once a patient starts taking them, oftentimes they stay on it for a long time, if not for, the foreseeable future. And so this has actually become a big problem that a lot of people who are, with off-label use are being prescribed this medication. And now the people who actually need it for the FDA-approved indication are not getting it. One of the ways that the entire market is combating this right now is with compounded versions. So this is certain pharmacies are actually able to, with the right regulations, create the GLP-1s, but in a lab. And so it is not exactly the same dose, but it is the same active ingredient. And so while, Glenn, what you're saying is correct, the rumors are true, that is one of the ways that the pharmacy system is trying to deal with it.
Wow, thank you for sharing that. You are watching Let's Talk America with host Shana Thornton radio podcast. We are live on Sunday, October the 27th. We're talking to the one and only acclaimed Pharm.D, Dr. Swathi, and we are talking about weight loss drugs. We're talking about GLP-1 weight loss drug category. Many of you know about Ozempic, other drugs as well, Ozempic being one of the most popular ones. We're talking about the effectiveness of it. We're talking about the safety of it, and we're talking about the proper usage of it, okay? It's a conversation that needs to be heard. If many of you, most Americans, a lot of Americans certainly are suffering with obesity, and they also know many people that are, right? So this isn't an isolated event, as Dr. Swathi has said. Obesity is real. It's gone up only since COVID. Unfortunately, and we've got to get to the root of it as much as possible. Dr. Swathi, you said that something that I haven't heard a lot of people really tackle, and that is how long to stay on the drug. Because I know people, friends, family, they're on it, right? And they have not mentioned that the doctor should say I should be on it for 6 months or for a year or two. It's like, I'm on it, and their mentality, I think, is that they're to be on it indefinitely. Now, from my understanding, and you help me out, I thought this was more of a temporary fix, if you will, or pharmaceutical notion. And now, is it true? Is it temporary, or is it meant to be indefinite? Because we know hypertensive medicine, if you put me on the water pill 9 out of 10, Shana's going to have to stay on it. And we know that once I get off of it, things go whack and I need to be back on my medication for hypertension. But for this class of drugs that's helping me with the weight loss, perhaps, and helping with my A1C and my fasting glucose, but I'm not supposed to be on it forever. True or false?
So actually, the way that they're supposed to be prescribed, at least as per the FDA, is that they are meant to be used long term. Okay. And so GLP-1s, the idea is that, you are prescribed that and it's a part of your diabetes regimen or a part of your weight loss regimen, and you continue to take it. At least that's how it's been written for right now. Yeah. And so it's fascinating, right? Because some of the backlash about GLP-1s is that, we actually don't have long-term data. And so even though we're saying, because it is, as you mentioned, such a new drug class.
Yes.
And so, a lot of people are hoping that, we'll continue to see these positive effects, which is great. However, theoretically, there also could be other risks associated with long-term use.
Yeah, thank you for sharing with us. Brandy out of Atlanta Metro, she's a medical provider. Thank you so much. She's a nurse practitioner. She says, as a primary care provider, the medication work for those who truly qualify. She says GLP drugs are a fix, but not a quick fix. The weight will return if the drug is used for weight loss. Those who take the medication have to continue the work. And Brandy does emphasize that stress, sleep, exercise, nutrition, it takes more than just the drug class of GLP. Your thoughts on that, Dr. Swathi? Thank you for sharing.
Yeah, wonderful point, because that is true. That, there are case reports that people who have stopped taking the drug, not only do they gain the weight back, oftentimes they gain the weight back even more. And so that's called rebound weight gain. And so that has become very common that people are saying, oh, I achieved my goal weight. I took it for 6 months, achieved my goal weight, but then they stopped taking it and then saw all the weight come back and then some. So definitely agree that is the case. And I also think that, as I mentioned before, it's all about what we can do from a whole person perspective if the GLP-1 is in question. And again, if it fits, if you're one of the patients that fits in that subpopulation that it's going to help treat, then, what can you do in addition in terms of lifestyle to really amplify its effect?
Thank you for sharing. We're talking to one and only Pharm.D, Dr. Swathi. She's on with us taking your questions. In particular, we're talking about weight loss drug, the class GLP-1. Get your questions in. And by the way, if you happen to be on hypertensive medicine, type 2 diabetes medicine, or any other type of medication, seizure medicine, if you're out there for pain as well, or if you're on thyroid medication, you have a quick question, you've been waiting to ask a pharmacist, get that information in so we can get that general information to you. I did want to address this because it's relevant. Vicky out of Atlanta says, if you get on the medication to lose weight, do you have to stay on it to keep the weight off? Sounds like the data suggests yes, right?
Yes, it does, at least for now. But, as we've been talking about, it doesn't come without its risks. And so I always talk about, 4 major risks or red flags associated with this GLP-1 blocker class of medications. The first one is GI issues. So this is, stomach upset, nausea, vomiting, diarrhea, constipation, and potentially long-term chronic digestive problems, just because the way that the drug works, it actually makes it so the stomach, it doesn't empty properly. So that's the first thing. The second thing is, we already talked about a little bit about off-label use. So this is, patients who are being prescribed it that perhaps, are not the best fit for it. And then the third thing is the potential mental health side effects. And so there have been case reports that, it causes mood swings or makes people feel more anxious, or all of a sudden they've lost all of this weight and they don't really know how to deal with it mentally. And so that would be the third thing. And then the fourth thing that I see that people talk about the least is the accelerated muscle loss. And so as people are losing weight with GLP-1s, this weight loss is actually a combination of fat and muscle loss.
Yes.
Mm-hmm.
And I think one of the things I want to address before we keep going with the questions, we got some great questions already mentioned and some coming up. Thank you so much. Keep your questions going. We now know that the conversation with a lot of dietitians and Pharm.Ds for years, I think so many people have focused on being slim and skinny, right? So many people, certain, especially different cultures. But now they're saying, but it's more about strength training and it's more about being strong and having that body muscle mass, right? Not so much just to be thin, because you and I know someone can be extremely thin and have an LDL of 450, which is very dangerous. And so being thin is not necessarily an indication of great health, which is such an important conversation to have when you're talking about weight loss drugs, because it's more than just losing the weight. And you're saying if you're losing muscle with it, what does that do in terms of when we talk about strength training and being strong? And it's some great data that goes along with strength training and breast cancer risk reduction and other things as well. So what a great point to bring up, doctor. Thank you so much. And I do want to say, I've heard so many people, the number one side effect to those are the GI issues. So much so that I've known several people that had to get off of the medication because it was too much for them to bear.
Yes, absolutely. And as per what you were talking about, muscle health is so crucial for longevity. And so, muscle not only provides, essential support for bones and strength and the cushioning there, it also is really important for metabolism in general. So muscles are active tissues that burn calories and regulate blood sugar. So all of that really goes hand in hand with how we can live healthily and powerfully for a longer time. And then if we think of muscles, also mobility is so important because, as your muscle strength improves, then your mobility often improves. And with mobility comes flexibility and especially as we age, also independence too. So there's just so many different aspects of why muscle health is important, and why, especially with GLP-1 use, we need to be talking more about, with this accelerated muscle loss, what can patients do to really improve their chances of not losing as much muscle?
Yeah. Such a great conversation. You are watching the one and only award-winning international show, Let's Talk America, with host Shana Thornton, podcast radio. I'm Shana. I am your on-air host and executive producer. We're talking about weight loss drugs. We're talking about the good, the bad, and the ugly with it. And I have an expert on. She's a claimed Pharm.D. She's worked with many consumers and patients out there, Dr. Swathi, and she's breaking it all down. And I love it because it's real talk for real people. We're going to keep with the questions because they are rolling in. Get your questions in. We're talking about weight loss drugs, but if you have a question again about any category, epilepsy medication, your thyroid, cancer medication, you have a Pharm.D on right now who's willing to give you general information, educational information on it as well. And also antidepressants, anything you've got, get those in right now. Chutney out of Atlanta, thank you, sir, for joining us. He says, how do insurance plans affect the price we pay for medications? And are there ways for patients to maximize their coverage? Great question. You're a Pharm.D. I'm sure you're very familiar with that process.
Yes. So, when it comes to the amount that patients are paying, it does come down to their health insurance plan. And so, depending on what your health insurance is, I can't speak to one specific person because I don't have your plan in front of me. I don't have those details. However, depending on your plan, there will be a different level of what's called a deductible. And certain medications will cost a different amount of money. Oftentimes that also has to do with whether it's a brand or it's a generic medication. A branded medication would be, like an Ozempic or a Wegovy, for example, while, a generic medication might be something as simple as a prescription ibuprofen at a higher dose. And so it comes down to those factors. The other thing that I will mention with this too is that, if you want to get a better deal, there are some platforms out there like GoodRx. I used to be a medical writer for them years ago, really educating consumers on what they need to know about integrative medicine and supplements and all of that good stuff. And so they are trying to really move the needle with, how can you help pharmacists help patients.
Okay.
And so when I used to work in the pharmacy, that is one of the things we did every time. If someone came and said, here's my health insurance, what price can I get? We would always check with platforms like GoodRx to just ensure, okay, are they actually getting the best deal or not? And sometimes they weren't even with their insurance.
Wow, great point. So thank you. Great perspective on it, talking about the insurance part of weight loss drugs. You're watching Let's Talk America radio podcast. Get your questions in. We have a claim Pharm.D, Dr. Swathi, on with us. Jeanette, by way of New Jersey down in Atlanta, she says, unfortunately for her, stress leads to the lack of sleep and vice versa, which leads to bad eating choices and less energy to exercise. It's all connected. Dr. Swathi, what a great question. I mean, a great feedback. You're an integrative pharmacist, so she's speaking your language right now, that it's all connected. And I think that's real talk. Thank you, Jeanette. She's a working mother. I mean, I think that's what a lot of people find. As much as they know they need supposedly 7+ hours of sleep, they know they're supposed to eat balance. But what they don't tell you is that, you can have a 1-year-old kid who doesn't want to sleep in their bed that night, and you've got lack of sleep. You could have a teenager that you're ripping and running across town for soccer, to basketball, to gymnastics. These are real things that people do encounter, which I think, in all fairness, I'm making excuses for people. But when we say quick fix, the quick fix is because a lot of other areas of their life are being taken away. Do you agree, Dr. Swathi?
Yes, I definitely agree. And the other thing I would say too is, if you are a patient taking a GLP-1 inhibitor or GLP-1 blocker, this class of medications, and this, and your case sounds a lot like Jeanette, you're busy, you're doing all of the things, you're trying to help everyone in your family, and you're working, and maybe you don't have time to work out. And sometimes it's hard to make healthy choices. That's why I actually always suggest, if you are on these medications or not, that certain dietary supplements can really help support muscle health. So I have top 4. I would say the first one is omega-3 fatty acids. We could get that from our food, like whether that's, from fish or chia seeds, things like that. But these omega-3 fatty acids actually really help reduce muscle inflammation and support muscle protein synthesis. So that's going to help create more muscle cells in the body, for lack of, more complicated explanation. And then I also really love branched chain amino acids, so specifically leucine. Leucine is great because it can prevent muscle breakdown, and that's definitely what we do not want. We do not want, our muscle breaking down because, unfortunately with age, that is just going to happen anyway. So if we can help support that through this dietary supplement, then that is a great way to go.
Yeah.
The next
Thank
thing I would say is, oh, sorry, I just had two more. So the next thing I would say is protein powder. So a lot of people are thinking about, okay, am I eating enough protein? But really, are you getting high quality protein? So this
Okay.
could be, from whey powder. If you're plant-based or you prefer that, you can of course go with a pea protein or something like that. But thinking about protein powders that are the least amount of ingredients, don't have a lot of additives, just so we can ensure that we're supporting our muscle in that way. And then the fourth supplement is actually called fortotropin. It's a natural compound that's derived from fertilized raw egg yolk. And in clinical trials, it showed that it boosted muscle protein
Wow.
synthesis by 18% in adults that were not exercising. So this
Wow.
could be a great fit for Jeanette or anyone else who resonates with her story, because this supplement is found in different products, but the one that I support is called Myos.MD. I'm actually one of their medical advisors, and I help educate, on how these different supplements can really help people figure out, how to support their muscle health, especially if they lead very busy lives.
Yeah, it's such a great point because I think so many times we say we'll eat natural, and we're all for that. If we could get the right amount of protein naturally. But real talk for real people, that working dad who has his own company may not be able to cook or to bake, right? The fresh, no salt, all the leave the sauces off in the oven to get the kids the proper protein, if you will, every day, or for himself. I mean, let's talk about himself as well. That may not be realistic. And I think so many times we do push that, but it's only so much hours in the day. And we know there, for instance, many people take vitamin D, right? I mean,
Yes.
and some people are like, well, I go in the sun. And we've had experts, dermatologists come in here and say, for some people, you can go in the sun, people of color, you can go all day and you can actually get a tan and get darker, but you still can have a deficient in vitamin.
Correct.
And
Yep.
that's just the truth of the nature, right? There's
Yeah.
something just to be realistic about.
Mm-hmm.
Yeah. Thank you. Lakeisha out of Atlanta Metro is saying, in your opinion, Dr. Swathi, is there enough research to support the use of these medications? Does the benefit, excuse me, outweigh the other health risks? Great question.
Yeah, great question. So, they are FDA approved prescription medications. So I would say, yes, there is enough research to support the use for which they have been FDA approved. So again, Ozempic, FDA approved for patients with type 2 diabetes, specifically with certain BMIs. And then Wegovy, so the same active ingredient, but just with a different brand name, FDA approved, again, for weight management, but for a BMI of over 27 with other conditions, or 30 on its own. So, I do think that there is rhyme and reason for using these.
Okay.
However, I don't think they should be used on their own as like a solo, what's called a
Okay.
monotherapy. Instead, we need to think of, nutrition and supplements and other things to support muscle health.
I love it. Weight loss drug talk, because that's what we're talking about. We're highlighting tonight on Let's Talk America Podcast Radio. Dr. Swathi acclaimed Pharm.D is on. We've got the questions rolling. We're not going to be on much longer, so keep those questions in. Brandy, the nurse practitioner out of Atlanta Metro, says GI upset, gastric pain, headaches, pancreatic issues, disease, skin issues have come up from using this class of drugs. It is let's talk about that. I mean, and right, I've heard some issues of pancreatic conditions flare up from this. What do we know about that so far, Dr. Swathi?
Yes, so all of the things that Brandy mentioned are true. They're all possible side effects. Again, they're not side effects that generally happen to every single person. However, they do happen to quite a few patients who take this medication. And specifically, one of the conditions that has been brought up and I keep hearing more about is actually called gastroparesis. It's a condition in which the stomach is unable to empty its contents properly. So the emptying is actually slowed down or impaired.
Okay.
And that's often due to damage of the nerves that control the stomach muscles. And so this is something that over time with the use of this medication, even in the short term, that they found that this could impact. And so, that could lead to things like bloating and nausea and vomiting. But in the long term, it could lead to, even bigger issues that, may need surgery or other medications
Wow.
to deal with. Yeah.
Yeah. And it's always, and we're a responsible platform here on Let's Talk America Radio Podcast. This information is for educational purposes
Yes,
only.
of course.
Of course, Dr. Swathi and myself encourage you for specific questions about your body and your reaction to any drugs that you're on out there. Or, I mean, let's be honest, even if you're having some side effect to some water things, you need to see your provider and your own pharmacist. Let them know your history, your family history, so they can make certainly an educated a medical opinion on what's going on with you. This is great information, real talk for real people. Brandy, the nurse practitioner, one of our personal favorites, said strong and flexible is better than being thin. I certainly agree. I love that. And we'll have another conversation about that as we bring a psychologist in, talking about body imaging as well. But so many people, Dr. Swathi, Brandy, you know this, you're a provider, Brandy. So many times we grew up, I'm a kid of the 80s, and what you saw on TV were thin supermodels, right? It was the Christy Turlington era. It was the Iman era, you know, a lot of that when they were tall and thin. And so there were a lot of people that looked at that, you know, in a very admiring way, wanting to do that and perhaps not always making the best decisions, realizing that being strong and flexible and agile was better than just doing whatever they had to take to be thin. Dr. Swathi, real talk for real people.
Yes, absolutely. And I couldn't have said it better myself. It's, you know, especially having grown up and seeing that there was the low fat era, the low carb era, all of these things. And it's more about what are the whole foods we're eating and what are the portions of these whole foods rather than, you know, something processed that says low fat or low calorie, 100 calories. It's like, but that's not really the point.
Yeah, such a great point. Chutney out of Atlanta, he says when it comes to generics versus brand name drugs, there's often a significant cost difference. So true. Could you explain why this is the case and how people can make informed choices? I love that. We're talking medical, and so much of the questions have been about the medical pharmaceutical side. But when you talk about pharmaceuticals, Chutney's right. Let's talk about the money of it, because affordability comes into play for many people. Generics versus branding. Help us out, Dr. Swathi.
Yes. So it depends on the drug. And that's a very weird, unexpected answer, right? But for a lot of the medications that you see, brand versus generic will function very similarly. And so when it comes down to cost, pick the generic. However, there are for example, for some psychiatric conditions, some mental health conditions, you know, we do see that certain brands work better than other generics. Of the same category. And the reason for that is that, you know, brand names always have the same exact dose. It's very highly regulated. Generics are also very highly regulated. However, they have a bit more of a threshold or range in which they are able to have their active ingredients. And so this could be, you know, a generic, you know, let's say, for example, we even see over-the-counter medications. We see the branded Bayer aspirin, but then we go to our, you know, local drugstore, to think of any chain, and then we see their version of a generic, you know, of an aspirin, let's say. So that means that the one from Bayer every single time will have the same amount of active dose. However, in a generic, there is more of a range. And so just something to keep in mind. Sometimes it is worth the $1 to $2 extra, but sometimes the cost differential is quite different. And so then it comes down to maybe try the generic, see how you feel. And then if it's not making a difference, maybe consider the brand. But again, this is something that's very patient dependent and very drug dependent as well. So, you know, on this topic, you know, GLP-1s and GLP-1 inhibitors, all of those, you know, there really aren't a lot of generics available right now. There are the branded options, and then there are the ones that are compounded. Some people refer to those as generics. I do not, because they are not technically, you know, what I would designate as a generic. But that being said, they are the same active ingredient, but they are being created in a lab specifically for a patient. And so that's why the dose can be different, because when it's compounded, you can create a different dose than what is in the branded product.
I love it. Great information you're sharing. We're objective here. Not endorsing which way over the other. Question about generics versus branded. But I will say, just even when we think of facial cleanser that's over the counter, and you often see one next to it that say half the price, same active ingredients. But I can certainly say that doesn't always mean you're going to respond the same. I know that firsthand. that you're not, just because they're saying active ingredients, and every patient is different. Most people may or may not, but I've interchanged some cleansers even from outside dermatology, and there was a difference, right? The
Yes.
body reacted different. So do keep that in mind. And I've heard of some documented cases, doctor, where people have been on seizure medication and switched over, and it was a significant difference where they had to go back. I'm sure as a Pharm.D, you've heard of those situations as well.
Yes, absolutely. So I think that category of medications has the same issue of, brand versus generic. Sometimes it really is worth going with the brand. However, it really, again, depends the drug. And, speaking of the cleanser example, I definitely know where you're coming from and your example, because then that helped me think of another point of, yes, it's the same active ingredient, but what is the way in which it's being derived or created in the lab could also be a different process.
That's right. Yeah, which can react to everybody's body differently.
Yes.
You can do totally fine with it, and I can have almost a chemical reaction to it on my skin. So great point. We're talking real talk for real people. Give a shout out to everybody watching us on YouTube. We love our YouTube viewers as well. Most of our questions are coming from Facebook, but Jada is out of Columbia, South Carolina. Hey, one of my favorite cities of all time for obvious reasons. Jada says, when using Ozempic or Wegovy, what are possible negative side effects that relate to mental health, depression, anxiety? And she said she did come in a little late, so if you covered it, she did apologize. She touched on it, but Jada, it's always a great question when you talk about any aspect of health. Will you talk about, I know you mentioned anxiety, some depression. Are there people, Dr. Swathi, that are more prone to that than others? Is it based off of age or gender, or not necessarily?
So yes, great question. So with Ozempic, also known as semaglutide, is the active ingredient. When we're thinking about, is this the right choice for a patient? Again, is it FDA approved for this patient population with those BMIs? But also, are they more like, do they have some sort of history of a psychiatric condition or some sort of mental health background? Because, if they've had that before, and it is possible that taking a drug like this could exacerbate that.
Okay.
Because there have been documented case reports of patients who really feel like they have mood swings when they're taking Ozempic. So this could be, feelings of irritability or feelings of sadness. There hasn't been anything documented specifically using the word, depression necessarily, but there have been anecdotal reports of these mood changes. So I think that now people are more and more interested in what this means. I think what's less common is also anxiety, but it makes sense if your body is changing so much and, your blood sugar is changing, your appetite is changing, that can also influence the way that you're viewing your day-to-day with a bit more of anxiety. So I think that it theoretically makes sense. But we've seen more case reports of mood changes or mood swings. The other thing that people have been reporting is, because of the way that the GLP-1 blockers work, is that actually the satiety center, the area of your brain where you feel hungry or you feel full, that is actually very close to the dopaminergic center. And so the dopaminergic center is all about, or the dopamine in general in your body is all about reward. And so people have been saying that, they feel less excitement about eating. They feel like less of a reward, or less of just being like wanting to eat. And wanting to eat foods that used to make them very happy. And so there's some theoretical discussion as well about, okay, if people are feeling this level of apathy towards, eating something that used to bring them a lot of joy, that now also could that lead to other feelings of low mood? So again, theoretical, but very possible. And again, very patient dependent. And then the other thing that we touched on very briefly in the beginning is that as your body is changing, and maybe you're not prepared for it, maybe it's something you've wanted for a long time, but you haven't actually worked through mentally of like what that will really mean when you achieve this, quote unquote dream body. There's also a lot of potential like feelings that could come along with that too. So it's really, it's not just, what you look like, it's really how do you feel about how you look like.
That's right. That's right. And embracing and loving who we are, regardless of the
Yes,
size
exactly.
of who
Mhm.
we are, right? I mean, one of the great things my father always emphasized and talked to me about when I was growing up was, and we live in a world where people are caught up on physical things, but he would always say it's more about your character and who you are inside. Because
Yeah.
as you grow and change, things happen. And you could gain weight, get skinny, back and forth, but your real character and who you are, right, should not be defined by your size or whatever that scale is saying, because you're still phenomenal inside. You always have to recognize that. Whatever comes with why the weight has gotten more and more. Thank you, Jada, out of Columbia Metro. Shout out. Thank you. Jeanette says, great info. She really appreciates it. Lakeisha said, thank you so much for sharing great information. Banasha out of Atlanta Metro, she said, great question. When it comes to the weight loss drugs, such as Wegovy, etc., I heard one doctor mention that more than half gained the weight back, and the number of fat cells increased. Have you heard that? Talk to us.
Yeah, so that's something we talked about a little bit. We just touched on before, but if a patient stops taking the medication, it is very possible that not only will you gain the weight back that you lost, but also you could gain back more. And so it's called rebound weight gain. So it is something that has been documented. I'm not sure about the number of fat cells increasing. That's very fascinating. Would love to look into that, but definitely about people gaining the weight back is something that we're seeing.
Yeah, thank you, Banasha and Dr. Swathi. Such a great point. You're saying you called it rebound weight as
Yeah.
well. And I think what's the thought of that is unfortunate because it sort of defeats the purpose why you went on it. And
Yes.
I've had conversations with nephrologists, and I want you to give your professional opinion on this, that
Mm-hmm.
talked about when people have drastic weight gain and weight loss, and what some of that pressure can obviously do, the weight
Yeah.
up and down due to the kidneys. Now, I've heard some, not sure if that's well documented, but some nephrologists have spoken on it. But I'm thinking
Mm-hmm.
if your weight is fluctuating back and forth depending on that, that could possibly be dangerous. Is there any credence to that?
Yeah, it could be. I mean, if your body is going from one to the other, like it's like if we want to create a parallel, it's almost like yo-yo dieting.
Yes.
That all of a sudden, you're one weight, then you're the other, and your body is just trying to acclimate and keep up with what you're doing. And so it can become that back and forth effect that really is in the long term not really going to be beneficial.
Yeah, and not to make light of it, but the body may say, pick a team. Which one are we?
Yes, exactly.
And always seeking balance, of course, in the middle. Dr. K out of Atlanta, thank you so much for being with us. She says, I was always under the impression that generic brands were just as good. That's scary. She's an educator, Dr. Swathi. She's saying it's scary because I do think a lot of times the notion, and I'll say this, perhaps some of your colleagues on the retail end, where we're filling prescriptions, have often sometimes said and hastily, oh, it's the same concept. And like you said, there are not cases where it can't be comparable, but depending on the person. But there's certainly some classes of drugs where I know personally friends of mine who have switched drugs and their body did not respond the same. And one of the scary categories, of course, were individuals who were epileptic. And
Mm-hmm.
that I do know of firsthand with two different friends. And so that was a scary situation, and it had to be adjusted right back.
Yes, absolutely. And again, it's very patient dependent, very drug dependent. It is the same active ingredient. They are regulated by similar standards. However, there could be differences in the inactive ingredients. And I feel like a lot of what has come out about the difference is, yes, there are different thresholds for the active, but at the end of the day, there's also potentially difference of the inactive. And I mean, even if you look at the two different pills, sometimes for what's brand and generic, one is purple and long,
Yes.
and the other is
That's
like a short, or
yeah,
like maybe not even short, but let's say
green.
one is round and one's oval, and they're two different colors. Like those are in different inactive ingredients.
Yeah.
Mm-hmm.
Yeah, that have a visual difference, and you think perhaps what can that do to the body? And
Yeah.
everybody's body
Mm-hmm.
is certainly different. And for
Yeah.
more specific information, speak with your provider. Dr. K says sometimes there's a major cost difference. Going
Yep.
back to the question we had earlier about generics, she's saying between if the insurance pays for the generic. Absolutely.
Mm-hmm.
Right. I mean, you'll see a huge difference of you owe us $2.85. Oh, you want branded? That's $195, which Dr. Swathi makes a big difference in people's budget.
It does. And sometimes, depending on what works better for the patient, sometimes shelling out the extra money is worth it for quality of life and for the treatment that the patient is looking for.
Yeah, and I know you obviously know a lot about this being a Pharm.D, but there are some drug programs out there. Sometimes even going to the pharmaceutical maker's website, sometimes they do give discounts if it's a new prescription, right? That's my memory of
Yes,
the
exactly.
pharmaceutical
Yes.
world. Yeah, that
Yeah,
can perhaps help with the cost of it.
absolutely.
And
Yeah.
obviously speak to the pharmacy for some other options as well. Get your last minute questions in because we're about to wrap up. Dr. Swathi, it's been such a pleasure having this comprehensive conversation with you about weight loss drugs and its effect on people. We've talked about the physical side of it, obviously that medical side we think of, but also we talked about the emotional and mental side and bringing out what I think a lot of people didn't know is perhaps a link between some of mental concerns and emotional
Yeah.
concerns on this medication. And as you mentioned, if someone has an underlying condition, that's probably something they need to make sure, as they may bounce from a doctor's office to an urgent care to a weight loss clinic, to make sure that whoever you're talking to has an understanding. If you have a background of anxiety, if you have had a battle with some depression, even if it's postpartum after you gave birth to your daughter, don't you think that's key to mention? Because if you're just saying I'm overweight, I'm pre-diabetic, and that's the only conversation you're having, if you're running to a weight loss clinic, that's not being responsible.
Yes, and one of the things I always say is, the drug or the supplement I don't know about is the one I'm most concerned about. Because, let's say you are taking a supplement or something that targets mood, that's something that I would want to know before I'm, would even consider some of the prescription medications out there. Because what we don't think about is that, yes, there are drug-drug interactions, but there are also potential drug supplement interactions too. So I always say that. The other thing is, if you are going to different healthcare providers with different specialties, always just keep a bag of your medications with you.
Good point.
Because it makes it so much simpler for the healthcare provider to just look through and say, oh, you're taking a supplement for magnesium. I mean, there are like a dozen kinds of magnesium. What kind are you taking? What dose are you taking? At what time of the day are you taking? How many times a week do you take it? All of those things are important before considering certain medications. So those would be my 2 bits of advice, is like, be open and honest about what exactly you're taking, because your healthcare provider will appreciate it, because it helps them make a more educated decision for you. And then always bring a bag of all your medications and supplements wherever you go to different healthcare providers' offices.
I love it. Let's Talk America offers real talk for real people. The one and only acclaimed Pharm.D, Dr. Swathi, gave us a great conversation tonight. As we wrap up, I have to ask this very final question on behalf of myself. It's real talk for real people. What would be your lasting words of wisdom, pearls of wisdom, as we call it here, Dr. Swathi, to that patient who desperately wants to lose weight? Maybe he hasn't necessarily done everything he could have done. He hadn't cut back on his diet. Maybe he hasn't necessarily exercised or doesn't exercise as much as he could. Maybe he's drinking too much or other things that could lead to weight gain or not being able to control the weight either. And they're presented with this from watching the commercials. They're presented with this because a neighbor down the street looks fantastic and lost 50 pounds like that. What would you say to that person that may be at a crossroads? But we know you're saying overall you professionally believe the drug class is safe if it's used for what it's prescribed for. But what would you say for the person saying, well, I don't want to be on a medication, I don't want to be dependent on something? We want your final words.
I would say talk to your healthcare provider and voice all of these exact concerns that you just brought up. Say, these are the things that I'm worried about. These are the things that I'm not sure about. However, these are the things that I really, really want. Yes. And therefore, that's why I think a GLP-1 could be a good option. Yeah. And also work with your healthcare provider to figure out what are the lifestyle choices that you're going to make that are just going to be a little bit different. Are you going to start integrating a walk into your daily life? Because that's something you can do. Is it parking a little bit farther away from the grocery store before you go grocery shopping? Think about the perimeter of the grocery store instead of just the inside of the grocery store, with the processed foods. And then, if you do end up taking a GLP-1 inhibitor, what can you do besides nutrition and movement? Thinking about those dietary supplements. Is it including omega-3s, fortotropin, myosin-D, something that can really help you help yourself?
Yeah, I love it. I love it. I love it. I've got to ask this final question. I know when so many people, we know it's for type 2 diabetes, or there's been some prescribing for people that have been pre-diabetic on the cusp, where some providers responsibly have said this may be beneficial to you. I've also known of some physicians who've actually put people on sometimes diabetic medication to help them sort of bring down some of that A1C, early, and trying to be very aggressive with it. But I think so many times we talk about weight loss. We talked about something, I believe that everybody's body is not going to look the same. Everybody's not going to be thin. But I've got to leave here with you seeing it from the medical perspective as much as possible. Do share the dangers of diabetes, though, because I
Yeah.
think sometimes with
Mhm.
so many people we know diabetic and pre-diabetic, we sort of say, well, they're diabetic, and there are people I love and adore who have thrived as people, individuals with type 2 diabetes for over 40 years. Okay, so we know they can, so those that are compliant and educated and aggressive about it can certainly be helped and live a fairly normal life. But tell us, for somebody out there that's saying, well, I'm not going to worry about the thirst in my throat. I'm not going to worry about going to urinate every 5 minutes, right? It's signs that something is wrong with the glucose, right? Tell us the dangers of not treating diabetes, because I think that goes into the risk, right? Of when people say, do I need to speak to my provider about an option for diabetes or not? How serious is diabetes, Dr. Swathi?
Diabetes, or type 2 diabetes specifically, is one of the most dangerous healthcare issues, I would say, right now. And that's namely because if it's uncontrolled, I mean, there's so many ways to control it, so that's wonderful. But if it is uncontrolled, it can lead to so many serious health complications and conditions, because with long-term high blood sugar levels, it can damage so many different organs and blood vessels, and just have immediate health risks, but also long-term risks. So I can run down a list of different ones that I think are important. So the first one is cardiovascular disease. So this is
Okay.
heart disease. So this, having type 2 diabetes, especially if uncontrolled, increases the risk of heart disease, of stroke, and of high blood pressure. And so over time, this high blood glucose can damage blood vessels. And so this can lead to the narrowing of the arteries. So this is atherosclerosis, which is the fancy term, but it can just increase the risk of heart attacks and strokes. And
Okay.
that's something that we want to fully avoid, but this can be avoided with controlling type 2 diabetes. The next thing would be kidney disease. So prolonged high blood sugar can damage the kidneys, and specifically the filtering system through the kidneys.
Ooh.
And so this can lead to kidney disease, but also kidney failure. And, when it's end stage renal disease, that often requires dialysis or even a kidney transplant. And a lot of patients that I've seen in dialysis clinics actually initially got kidney disease from having type 2 diabetes. So it's very common, actually, unfortunately. Another thing is nerve damage. So again, this high blood sugar levels can cause numbness, tingling, pain, or even burning if you think of the parts of your body that are the farthest away from your heart, so things like legs and feet or even hands. And then this can lead to issues with balance and other potential issues like infections that you might not even realize in these areas, because you don't have feeling in these areas as much anymore. Another big thing is eye problems. So it's called diabetic retinopathy, but again, this high level of sugar can lead to blindness in adults. And so it's not only just blindness, but it could also lead to things like glaucoma or cataracts, or even in some severe cases, vision loss as well. So as you can see, there's so many potential issues with just those four that I mentioned, but it could also lead to things like skin conditions, like, again, infections, dryness, itching. You might have heard of, people having issues with their feet. So, if you have high blood sugar, that can lead to reduced blood flow. Again, if the blood vessels are not functioning the way they're supposed to, and you have nerve damage, all of a sudden, you could have issues with your feet. And that could lead to an amputation in the absolute worst cases. And then having high blood sugar as well can also lead to issues in your gums. So this could be gum disease. And this, again, is with blood vessel issues. So poor circulation and poor, blood support to your mouth. And then the more of the recent ones, which are really interesting to me, is, how is sugar tied in with mental health? And so this could be like an increased risk of mental health challenges because of the way that blood sugar influences the brain. But also some of the newer research is talking about how type 2 diabetes has to do with dementia, and that it has a higher risk of dementia associated with it, again, because the blood flow and the sugar impacting the brain. So those are just a few. There are so many potential short-term and long-term issues with having high blood sugar. And so this also is like, you don't have to be diagnosed with type 2 diabetes to have these issues. This could just be that you have elevated, higher than normal, but you don't fall into the quote unquote parameters of what is designated as type 2 diabetes in the US. So there's just a lot to be said of just choosing the right foods, the right supplements, and the right prescriptions.
Yeah. And if you're diagnosed, like so many people have been, type 2 or pre-diabetic, it is not a death sentence.
No, not at all.
It doesn't have
as
to
long
be.
as you control it, then you are set on the right path.
Yeah. And I think it's, and so many people have parents that are type 2 diabetic. I know you would say be even more vigilant, because if mom or daddy is, odds are, right? I mean, I've had many endocrinologists come on this show and say, you better be awake if mom or dad, both or one, because it's certainly, there's a prominence there. True or false?
Yeah, definitely.
You mentioned kidney disease when you talked about type 2 diabetes. And I couldn't help but think, when we talk about dialysis, that there's so many, we know there are many risk factors for disease or kidney disease, but for men of color, obviously have suffer with kidney disease, from my understanding, higher than any other group. And when we think of that, I think it's something to be aware of, even more vigilant about type 2 diabetes for men of color, if that's already there underlining. And of course, hypertension, some of those other risk factors lead to it, but something to be even more aggressive about. Do you agree?
Yes, I do. Absolutely.
Thank you so much. Banasha said, I heard just today that studies have shown that ozemic helps with Alzheimer's prevention. I actually saw that last week. Thank you, Banasha, for closing us out with that very, very important point. I did see that they said there was some link of documentation with it. I do think the study was limited. Dr. Swathi, I'm not sure how familiar you are with it. Your thoughts on that?
Yeah, so there are some clinical trials underway looking at GLP-1 drugs and what role they can play in slowing cognitive decline. So again, like associated with Alzheimer's disease and research, but the studies are still in very early stages, and so we don't have the definitive outcomes of the studies yet. And as far as I know, the studies were not done in humans yet either. So it's very preliminary, but it's very possible. I mean, who knows? Yeah.
Well, and I think it goes back to what you said, that there's some links now to type 2 diabetes and or blood sugar and dementia and Alzheimer's anyway. So perhaps that could lead to just the conversation of being compliant, right? Of being compliant and keeping blood sugar. If it's helping with that, I would imagine it's the overall cure for that type 2 diabetes.
Yes, exactly.
Which would be the most important part. What a great discussion. So comprehensive and so informative. Thank you, everyone, for all of your questions, getting it in. We ran over, but I think it was such an important conversation and points to make, because after all, when it comes to your health, it's everything. We talk about wealth, but there's nothing like your health, because it's the only thing that allows you to be here. Dr. Swathi, I know you would agree. Dr. Swathi, you have great resource of information for us. Where can our viewers and listeners go, right, for more information on you, or if they need to ask questions of you, or just great questions in general about the weight loss drugs or any drug in general?
Yeah, so you can follow me on Instagram at Dr. Swathi with Dr. spelled out. I'm also most active on LinkedIn, so you can just search my name and you'll find me there, where I do conduct different webinars on longevity with MyOSMD as one of their medical advisors. So if you want to follow along there, please do so.
Thank you so much. Yolanda out of Atlanta says, great topic and a lot of helpful information. Thank you, Yolanda. And Vicky out of Atlanta said, great topic, ladies. We appreciate it. Banasha said, great information. Thank you. Thank you. What a great positive feedback. We certainly appreciate you, Dr. Swathi. We're going to have you back on again. So right before the holidays, we talked about weight loss, doing it the healthy way. We're going to revisit you in February when the gyms get empty. I'm joking.
Happy to come back anytime. What a great engaged discussion with your audience. I absolutely loved it. It was such a great experience.
Thank you. Thank you. We're going to have you back. It was your world debut, but you're going to be a fan favorite here. I already can see that so much. Thanks again for joining us, Dr. Swathi, and connect with her to get more great information about preventive care for important disease states. You know, everyone, we appreciate you watching Let's Talk America podcast radio. The reason is because this is your platform. It's the questions, it's the guests, it's the topics you want to know more about, okay? And we never know in life where things will hit us, where we may need to lose the weight, where our child may need to lose the weight, where our fathers may need to lose the weight, or they're battling with glucose that won't come down. Knowledge is key, but applied knowledge is everything. So thanks for joining us. Stay with us, okay? I wish everyone a wonderful holiday season. Can you imagine? We're already in November. It's going by very quickly. We've got some more episodes coming up for you, and we're going to celebrate 2025 together, everyone. Take care, stay safe, stay healthy, and stay connected. Let's Talk America with host Shana Thornton Podcast Radio offers real talk for real people. And that's you. Take care, everyone. Thank you, Dr. Swathi. You were amazing.
Thank you. Bye-bye.